as I'm letting people in. Just a few things. ADHD, for anyone who's not been to a meeting before, we are a Kansas City chapter of an organization called CHAD. And as you can see on our slides, we have all sorts of different free monthly activities. And whether it be for parents, women, just adults, teens, some online private groups to join. So please check us out. Our website is www.adhdkc.org, I believe.
Yep.
Anything I have not covered that I need to, Kristen?
I don't think so.
Okay. All right. Well, without further ado, I'll let you get going.
All right. I have an additional disclaimer tonight because the Chad disclaimer covers Chad not endorsing anything specifically, but I also want to say that nothing tonight is presented as medical advice for you specifically. Strategies are going to be shared, but not treatment recommendations. Treatment plans must be individualized with your prescriber. So always consult your prescriber before making any changes to your medication. All right. So research shows that ADHD is associated with differences in brain structure and function, especially the areas related to attention, executive function, motivation, and emotional regulation. And these include the prefrontal cortex, basal ganglia, the cerebellum. Kids with ADHD have delayed brain maturation. On average, the development of certain brain areas are several years later. They approximate like 30% delayed. It doesn't mean that their brains are damaged or bad. I think of it for the adults in the room like a fine wine. It just takes a little bit longer for them to develop, but they can still be fantastic brains, very intelligent, smart brains. Or they sometimes have developmental delays in other things, maybe intelligence, but it can span the entire spectrum of intelligence. So this delay does not mean that their brains are broken. They just take a little bit longer to mature. There's also differences in the neurotransmitters of the brain with ADHD, and the neurotransmitters bring messages from one nerve to the other. Excitatory neurotransmitters regulate motor development, thought processes, anxiety, and other things. They help us stay alert, but when they aren't moderated by inhibitory systems, things get out of control. Like you can have too much anxiety if you have too much of one type of neurotransmitter. But if you have too low, then you lack motivation and you have other problems. So the inhibitory neurotransmitters act as little brakes, and we need brakes so that we don't feel restless, irritable, out of focus. And once our brakes work, we can excel. Without them, we're out of control. And Dr. Ed Hallowell has this famous quote that I put on here, basically likening an ADHD brain to a Ferrari. Ferraris are fantastic cars, but they get bicycle brakes. The brakes are not sufficient for that brain. So it's a very good way to look at it. And I use that a lot with kids so they can understand that their brain can be great. They just need better brakes. So stimulant medications, which we're going to spend the majority of the time tonight talking about the side effects of these, but stimulant medications are the old-fashioned Ritalin, which is methylphenidate, or Adderall, which is amphetamines, and then non-stimulant medications, guanfacine, atomoxetine, clonidine, other things, are part of ADHD treatment. And contrary to fears that medication might dull or damage the brain, studies actually show the opposite. Medication can normalize brain activity in key regions that are important for attention and impulse control. Stimulants improve dopamine and norepinephrine, two of the neurotransmitters that affect our focus, our motivation, and our executive functioning. And long-term medication, I hear a lot of parents worry about putting kids on something that will be a long-term medication, but opposite of what many parents fear, it's not going to have negative effects on the brain. In fact, it often helps kids' brains develop in a more typical fashion. So they act more neurotypical while they're on a medication. Doesn't make them normal, but it helps them function more like neurotypical kids. And as their brain grows and develops, it can help long term it look more like a normal brain. And I'm considering long term as anything used for years. So starting when children are under the age of 9 is actually preferred, and it's approved over the age of 3, actually, to start kids on medication. The large majority of kids that are in the preschool groups can use behavior modifications and other things and not medication. But if they need it for safety reasons or family dynamics or whatever, even 3 and 4-year-olds can be put on these medications. And then ending at the end of life, some people are on it through their adult years. Some people can stay off of it during their adult years. So long-term can be decades. Brain imaging studies suggest that kids with ADHD who take medication over time show brain development patterns more similar to kids without ADHD. So it doesn't mean that it fixes the brain, but it definitely helps the brain mature in ways that are advantageous for a lifestyle that allows them to do what they want to do and can do. So all that's great, but there are, of course, reasons to either not take medication or to adjust medications or change medications because sometimes a particular medication is not tolerated very well. So we're going to go through tonight all of these different things that could be side effects. And on this slide, you see the little icon of a computer with a checkbox. And anytime you see that, I'm going to try to ask you a question that helps everybody pay attention and stay awake and alert a little bit better. But as somebody already asked something in the chat box, I will try to watch it. And so if you have questions, you can also ask. I have a ton of information though, so we might just want to wait till the end and condense all the questions into one set of them. All right. So as we get started, use the chat box to state if you or your child is either on medication regularly, takes it intermittently, kind of as needed, used it but stopped, or has never taken it. I just kind of want to get a feel for how often people are taking medication because it is considered the primary treatment for ADHD of school-aged and adult people with ADHD. So we've got daily, not during summer or weekends, and stopped entirely, it looks like, and then regular medications. So, and now trying out daily. So a wide range, pretty much all of those answers, which is good. And that's pretty typical. I think it's easy to say that these medications work for 85% of people, but it's hard for 85% of people to take these every day as they are probably prescribed. All right, we're going to talk about what we can do if the side effects happen. Okay. This slide shows the many types of medications that we use to manage ADHD. And you don't need to memorize them, but it just kind of groups them into stimulants versus non-stimulants versus things that are used off-label. And the stimulant medications, again, are the Ritalins and the Adderalls, methylphenidates and amphetamines. And each one of those are broken down into short-acting and long-acting. And long-acting isn't even really that long if you think about the day. It only lasts 8 to 10 hours. So it generally, a long-acting lasts the school day or the work day, whereas the short-acting generally work about 3 to 4 hours. Sometimes they're both used in the same day to cover the extended day that high school and adult people have. So those generally have the same side effects, but any individual person might respond better to the Ritalin or the Adderall family. Methylphenidate is Ritalin, Adderall is amphetamine, and I will generally use Ritalin and Adderall because they're more commonly recognized and easier to know as a layperson. But the stimulants tend to cause appetite suppression, trouble with sleeping, sometimes some mood changes, and we'll go through all of those. The non-stimulants are all different categories. Atomoxetine is Strattera, and so that one's been around for long enough that it's generic. The other one that I cannot say that starts with a V is Qelbree. It has been around not long enough to be generic, and I loved it when it first came out and coupons were working. I really don't have anybody on it right now because it's atrociously expensive, and the coupons don't work with most insurance companies anymore. But it worked, I think, better than the Strattera does in general. Better tolerated. But the side effects for both of those could be sleepiness, appetite changes, things like that. Alpha agonists are interesting. They affect blood pressure and they work completely different than the stimulants. And oftentimes they're used together with the stimulants. They cover a 24-hour period, which is great. And so does the atomoxetine and the Qelbree one that I can't pronounce. Those all cover 24 hours. So non-stimulants do have those benefits. The downside to the non-stimulants is They don't work quite as well as the stimulants for most people, and they sometimes don't work at all. And they all take about a month to kind of build up in the system. They have to be taken every day. They can't just be taken as needed. And so it takes time to build it up in the system and level it off. So people need to commit to at least a month to know if it's going to work or not. And it only works maybe 40 to 60% of the time, or takes the edge off, but doesn't really work as well as the stimulants. And then I'm not really going to talk about any of the gray medications. Those are all off-label uses, like bupropion, which is Wellbutrin, is used quite often. It's approved for anxiety and depression, but it has been shown to help with ADHD, and it will probably never get a label for that because there is no incentive for a company to spend money on research to prove that it works when people are already using it for that purpose without spending the money. So off-label doesn't necessarily mean it's less safe, just means that it doesn't have that indication. All right, so this graph I kind of made in an attempt to explain the timing of when medicines take effect and how long they last. All of the medicines we take have a graph that's like this, but they all are based on the drug itself, the delivery system of how it's given, and the person's metabolism. And by delivery system, I mean the short-acting medications, everything's given at once. The long-acting either are like in little beads that maybe you get 30% in the morning and 70% in the afternoon, or 50-50, or 40-70, or 40 and 70 doesn't add up, 40 and 60. But the beads are all timed differently. Or Concerta is that pill itself that releases medicine slowly throughout the day. So the delivery system does very much affect how any individual person responds to a medication, how quick it takes effect, and how long it lasts. And all of the stimulant medications are given based on need and response and not weight-based. So the atomoxetine or Strattera and Qelbree are kind of dose based on weight or age, but most of the ADHD medications, we start low and increase as needed and tolerated until we get to a point that it's either working well or not tolerated. And in this graph, the middle section of purple is where we want it to be. The two lines on the side are basically when it starts working and when it stops working. The number one arrow is when you take the medication. So when you first take a medication, it takes anywhere between 30 minutes, maybe an hour for it to start working. So this is important when kids have to drive to school, or if they just need to be okay when they start school and they have to put their book in their cubby or whatever it is they need to do. So you need to kind of know when it starts to take effect. And that would be the arrow number 2. Arrow number 3 is when we get too high and we start going into that side effect zone. And we want to try to avoid that. So when we're increasing our meds, if we think, oh, it's not working well enough, let's increase it. Oh, it's not working well enough, let's increase it. Let's increase it. Oh no, now we're having side effects. Then sometimes you can just back down to that last dose that was okay because it was effective enough at the dose it was. Sometimes the side effects are too prominent and need to switch. But basically, the time of the white line or the white arrow is the effective dose. And so the timing specifically from 8 a.m. to 3 p.m. is going to vary. It might be a little sooner or later or shorter, but the general curve of this is the same. So when you are thinking about any medication changes to dosing, it's important to try to tease out, maybe by talking to the teacher or watching your child directly or asking the child who is sensitive to when the medicine works and doesn't work, if they can tell. I'm trying to figure out when it's working and the timing of it. And that's very important. All right, so this is an ideal graph as far as side effects go. The goal is to get as close to that top line before crossing into the red zone, because then you're going to maximize that effective dose time. And remember that thin arrow in the middle of the purple is the time that the medicine's working. The lower the peak, the less time, because it's going to come down sooner. Does that make sense? It's kind of confusing. And you don't really have to know this. As long as you can communicate with your prescriber when it's working, how it's working, what side effects you're noticing, the prescriber should hopefully understand all of this. Now, have any of you guys, either personally or one of your kids, needed a longer duration? Like it works great, but it stops at 1 p.m. and you have a longer time that you need it. Does anybody have a situation like that? Either a thumbs up or a chat box? So it wears off a little bit. Yep. So very common problem. So if, like in this blue graph, the medicine is getting up there, um, so it's 2 doses a day. That's going to be my next part right there. Um, so if you're in the blue line here, you are taking medicine in the morning. It works great for that purple part, basically where the yellow line or the yellow arrow is here. It's working there. But if your day is longer, there are a couple different ways that you could extend this. The first that I usually try, as long as side effects are not significant, is I increase that morning dose. Now, the increased dose doesn't have a longer half-life, but you can see the purple line. I'm giving a bigger dose there. It's going to get higher. And as long as it stays out of that red zone, we're good. It'll last a little bit longer because it has longer to fall, right? The other way that we can change that is to add a second medication. So a couple people in the chat box said that it wears off early enough that they take that second medication. The graph is for, oh no, the graph is for immediate release as well as long-term. So in the long medication, that's why I left times off of here. If you were taking a short-acting medication, it would be expected to last about 3 to 4 hours. If you're taking a long-acting medication, it would last about 3 to 4. So in this one, I have the person taking a long-acting medicine in the morning with that purple, and then the more, I don't know, pinkish graph is a short-acting booster at the end of the day. So this would be very common for school-aged kids. They take a long-acting medicine in the morning, and then around 3 or 4, whenever they get home from school, they take a short dose. So number 5 in this arrow is where they take that short-acting medication. And this is leaving a little bit of a gap. So you don't necessarily want to take it exactly when you notice nothing else. Like when you're back to that no effects area, you might want to take it a little bit sooner, kind of overlap when one medicine is wearing off and the other one's starting. And that's where your prescriber isn't necessarily going to be able to tell you exactly when to take your medicines. You're going to have to kind of figure out when it's working for you or your child. And I know that's a lot, and you don't have to know exactly what timing is and things like that, but sometimes it's a little bit of trial and error. Does that all make sense enough? Yeah. Okay. Now, some people will ask very commonly, have you guys heard about the test that you can like swab the cheek to test which medicine to try because it'll work best? Has anybody heard of this? I see a thumbs up. Yeah. Um, so Beth has not heard of it. Good. It's really not what it's made out to be a lot of the time. It's something that you can order over the counter online and swab the cheek, and it's supposed to tell you if your genetics work best with this medicine or this medicine. Unfortunately, it doesn't do that at all. It can tell you how fast your body's going to metabolize things, and sometimes if a medication is really unsafe for you, but that would be a very uncommon situation. It does not tell you if Ritalin or Adderall is going to be better or if you should be on a non-stimulant. It's not quite to that level yet. So there are actually FDA warnings against some of these companies. And at the current time, it's recommended to start with a stimulant medication at a low dose, increase if needed and tolerated until you get to the point where it's working well and lasting long enough. Kind of looks like steps as you increase. So it's called stepwise titration. And ADHD specialists recommend methylphenidates as a first-line choice for treating children and adolescents, and amphetamines as first choice for adults based on typical response patterns. But sometimes it's flip-flopped. Sometimes little kids do better with Adderall and adults do better with Ritalin. But typically, if you're looking at big groups, little kids do better with the Ritalin family and adults with the Adderall family. And then the non-stimulant medications generally are considered third or fourth line tries, meaning you try Ritalin first and then maybe a second type of Ritalin because the delivery system might make a difference. Some people are so sensitive. I know my own daughter, when she was medicated with Concerta, it was great until Concerta had generics that were different delivery system. She was evil on those. And we went shoe shopping for one of her dances. She wanted to go shopping for shoes for her dress, and she lost it at the store and said, I just got to go home, and didn't get shoes, which is fine, but it was horrible. And so she knows she either has to take name brand Concerta or a different type of medication. She cannot do the generics. So sometimes it's as tricky as that. And that's why I know it's scary to try a second medication or a third medication. But sometimes when you find that right one, it's just like, wow, this is amazing. Angels are singing or whatever. But the first couple tries can be very difficult. And the more you can communicate with your prescriber of what you're noticing, the better. The non-stimulant medications are considered third line, again, because they only work 40 to 60% of the time. You need to be on them for a month before if you know if they work. So that is a delay to appropriate treatment if one of the stimulants would have worked better. Because those you can figure out pretty quickly because they're in and out the same day. So after you have a significant amount of time to watch the side effects, you can change the dose or change the medication. All right. So side effects. The most common side effects with stimulants and many of the non-stimulants are appetite changes. And we also need to remember that ADHD itself is associated with a lot of problems with eating. Impulsive eating often leads to obesity. And so many adults with ADHD, whether they were treated with stimulants as a kid or not, end up overweight or obese as an adult. There's a very high correlation with that. Some kids, though, kind of forget to eat, or they sit at the table and they're so busy talking at lunch, they don't eat enough. So some kids with ADHD have trouble gaining appropriate weight when they're young. They're running around all the time. You don't know where they're getting their energy because they just don't eat. And then, of course, if they start their medications, there are some kids like my own daughter. When she first started medication, she ate better because she could sit at a table for 15 minutes and actually focus on her meal instead of getting up to dance or talk or do whatever. Interestingly enough, same person, same medication. She basically, when she stopped growing, she said she couldn't eat when she was medicated because it upset her stomach. She didn't feel hungry, and if she forced herself to eat, so during high school, she just used her lunch hour to get homework done so she didn't have to do it after school because that was when medicine wore off and she had other activities to do. So it kind of worked out for her. And as long as she could get the calories in, I was fine with that. All right. So ADHD itself can affect eating, but then medications definitely can suppress appetite. So if kids are having a hard time gaining weight, you're going to want to use times that they're not medicated and hungry to give them the calories they need. So have them eat big breakfasts. And to me, American breakfast of cereal is not a healthy breakfast. They need protein. Because protein and healthy fats take longer to digest and will give them give them energy throughout the day. So even if they don't eat as much at lunch, they can sufficiently get the nutrition they need. And then you can use shakes that have added calories and nutrients. Limit the things that have fewer nutritive value. So don't pack a little Debbie snack cake or cookies in their lunch every day. Some kind of protein, some kind of fruit or vegetable. Have them have a milkshake or something, not milkshake, but a shake that's nutrient dense. They sell all kinds of things like that. You have to find one that they like the taste of. You might need to sometimes change the medication type that they're on. I do have a few kids who are just really struggling to gain weight. They do so well with their long-acting medication that instead of doing that long-acting medication, we use the same type of medication but in a short-acting form. So they eat breakfast, take their medicine in the morning. Then the medicine wears off midday. They eat lunch, take a medicine at school or at home midday, and then they're medicated until dinner time, basically, and then it wears off. And if they need an extra dose later, they could do that. But that one's kind of tricky because of bedtime. Some people will consider medication holidays, meaning they don't take medication on non-school days unless they need it. And that helps them feel more hungry if the appetite suppression is significant. And sometimes we use an appetite stimulant. Cyproheptadine is an old-fashioned antihistamine, kind of like Benadryl is an old-fashioned antihistamine. Cyproheptadine never really was used well because people gained weight too much on it. But if your appetite is not good enough, you can take that and increase your appetite. So there are kids who will do that. And sometimes they only take that as needed. They can pulse it to help increase their appetite. And then the foods they should eat, again, a plant and a protein is what I always tell kids because it's easy to remember. So an apple with peanut butter, grapes and cheese, yogurt and berries, chicken and broccoli. I don't care what the plant protein combo is, but the more variety of colors they eat, the better. If it's a fruit or vegetable, if they have healthy fats like avocados, nuts, and other sources, those help not only absorb fat soluble vitamins, but they give more calories, more nutrition. And again, fats and proteins take longer to break down. So if they're going to not eat a big midday meal, then something substantial at breakfast can definitely help. And fats have a bad name, but we really need fats. So as long as they're healthy fats and not fried chicken nuggets all the time, then we're pretty good. All right, and then you can try to boost calories with foods. You can have them drink whole milk instead of skim milk. You can give them buttermilk or add whipping cream before whipping it into their milk. You can add powdered milk even into milk. And any recipe that calls for milk, use a high-calorie supplement such as whipping cream or whole milk instead of just skim milk. You can add cheese to eggs, burgers, potatoes, vegetables, salads, bread, anything like that. And then using butter and oil on vegetables, potatoes, anything that helps it taste good too, but gives them more calories. All right. Any questions about nutrition before we move on? Not really nutrition, but appetite. Sleep problems are another super common problem just for people with ADHD, because people with ADHD brains are on fire, right? They're thinking of all the thoughts. And when you lay down, there's nothing to distract you. So you think all the thoughts, and that can keep you awake. Anxiety does the same thing. So sleep problems in general are typical with people with ADHD. And I do feel like there's two different reasons when people are taking stimulant medications that they seem to have worsening of sleep problems. One is if they take the medication too late in the day, the stimulant can affect going to sleep. Now, there are a lot of people with ADHD that say they sleep better if they have their evening coffee, because the coffee stimulant just decreases those thoughts enough that they can actually calm down and go to bed. And I do have a few kids that, for times they need to go to sleep, they will either drink a caffeinated beverage or take a very small dose of a Ritalin or Adderall. Unfortunately, stimulants, whether it's caffeine or a medication, can affect sleep patterns. So they're not my favorite thing for them to do, but that helps calm the brain. Some people will also use other non-stimulant medications because the non-stimulant medications cover 24 hours. So it helps to calm the brain even in those sleep times. So that can be very helpful. And some of the medications specifically, like the clonidine and the guanfacine, tend to make people tired. So that can help. But let's talk about sleep from, again, medication and timing. I was kind of getting ahead of myself. So if you take a stimulant, you want to avoid it too late in the day because it can affect sleep quality in addition to being able to fall asleep. But it does have that paradoxical effect where some people do feel like they sleep better with a little bit of stimulant before bed. And then also consider the use of other substances, whether it's nicotine, alcohol, CBD oils, THC, marijuana, and melatonin. All of those things can affect sleep. And a lot of people, if they are in the habit of smoking or vaping, don't necessarily recognize how those things disrupt sleep in many ways. So hopefully none of your kids are doing that stuff, but unfortunately I do know that some of the kids are doing that stuff. So if you have a kid who might be at risk for using one of those substances, talk to them for sure. All right, screen effects. How many of you guys have kids who want to be on their devices all night long? Yeah, it's a huge issue. It's fun. People with ADHD tend to have low dopamine. They crave the things that cause or increase dopamine, and screens increase dopamine. Doesn't matter if you're watching TV, playing video games, scrolling through whatever mindless stuff you're doing, it increases your dopamine. So kids all want to do it. And the light on these screens suppresses melatonin. We need melatonin to feel tired. So if they are using a screen an hour or two before bedtime, it is going to impact their sleep. Now, there are screens changes that you can make to take out the blue spectrum of light or wear those orange glasses that can help. But it's not as good as actually turning off the screens, because not only does the light inhibit melatonin, but those games and the things that trigger, it makes your brain want to do it more and more. So it's just not good. You've got to turn that stuff off. They can do other things before bed, but turning screens off an hour or two before sleep is really important. And have them charge things in your room or in the kitchen or someplace that you'll see if they sneak it back, because it is such a draw. If your kids use screens or their phone for an alarm, buy a $10 alarm. It is so much more important for them to get sleep, and you can spend $10 to get a cheap alarm. So much better. They can do quiet activities like puzzles, coloring, anything that helps calm the brain instead of doing a device before bed. All right. And then routines. Routines are huge. We all respond to routine. Our brains kind of get in the habit of recognizing the next thing we're going to do. And so if bedtime is a routine, that can totally help. So it's not just bedtime, actually, the whole day. And the things that we do in the morning, getting up, getting outside some natural air, natural sunlight helps reset our circadian rhythm. But then also exercise early in the day helps our body physically get tired so that we're more ready for bed when it's bedtime. Consistency is huge though. Have a sleep time and a wake time. And in the summer, I know those get shifted a little bit, but try not to get crazy. There are some teenagers who stay awake till 2, 3 in the morning every night. And then when school starts, it's impossible for them to get up on Monday morning. Um, keeping those routines and trying to have them only do sleep in their bed. So they shouldn't be doing homework in their bed. They shouldn't be doom scrolling on their bed. They shouldn't be watching movies in their bed because you want the bed to be associated with sleep. So all of those things definitely help. And I know for me, one of the things, especially when I'm anxious about stuff, doing a little journaling or reviewing my calendar so that I don't have to think, oh, what do I need to do tomorrow when I lay down? I set that time as part of my bedtime routine so that it's done. I've already done it. I don't need to do it when I'm in bed. Cooler temperatures and dark rooms definitely help sleep, help get your body ready for that. And then pets, some kids will insist they sleep better with their pet. And that's probably because anxiety is calmed when you have that pet. But pets also wake up in the middle of the night or lay on your face or do whatever. So I have a question mark next to pets. You kind of have to look at that individually. If your child truly gets better sleep when the pet is there, fabulous. But if the pet is waking them up, I would not allow the pet to stay in the room. It's just not worth it. All right, and then background noise. There's actually a lot of research, and I don't know all my colors of noises, but I do know that, the white noise is that consistent thing like a fan. Brown noise kind of gets louder at low frequencies and softer at high frequencies, like a storm or a jet engine. Pink noise is more intense at lower frequencies, like rustling leaves, heartbeat sounds, steady rain. I put a QR code on here, but you could just search for sleep sounds. And there's sleep music, there's sleep sounds, there's sleep stories, there's all kinds of things that help people fall asleep. But I don't want them using their phone or an iPad or anything to get to these. If you ask your Alexa app or speaker if she can do some of these things, much preferred over anything with a lighted surface. All right, and then weighted blankets have become popular. Does anybody here use those? I see a hand. Yeah. The weight is intended to provide that proprioceptive input to the brain, which has a very calming, kind of organizing effect on the central nervous system. They're generally considered safe for kids 3 years and up who weigh at least 50 pounds. I don't know many 3-year-olds who weigh 50 pounds. So the weight is supposed to be about 10% of the body weight and between 5 and 12%, I guess, is appropriate for older kids. Weighted blankets can make breathing more difficult, and some people that have asthma or other sleep problems, diabetes, poor circulation, might be advised not to do it. So you always want to check with your physician, and if they don't know much about it, occupational therapists tend to be very well versed in things like this. So if your physician or prescriber doesn't know about it, maybe work with an occupational therapist. There's also in this picture, you can see like the compression sacks or sleep pods, they're sometimes called. If people don't like the heat buildup of a weighted blanket, they can do these because they're very thin materials, but they're stretchy. I do feel like when people start with any of these, sometimes they feel claustrophobic because they can't move as much. So it can take a little bit of trial and error, but those would all be something to consider to help people calm down. All right, and I briefly mentioned melatonin before. Has anybody here tried melatonin or had their kids try melatonin? I think most people have tried it at this point. My own daughter was on it from like the time she was 2 until adolescence. She just needed it all the time. Oddly enough, during adolescence, when most people have a harder time falling asleep, she slept better. I don't know. She's weird. But I do feel like we need to talk about it a little bit. So melatonin is naturally made by gland in our brain called the pineal gland. It increases with darkness, decreases with light. So that's why we need darkness to make us feel sleepy. It helps us stay awake during the day when it's suppressed. And if you're struggling to wake up at an ideal time, the best thing you can do is go outside in the morning, get some natural light. Or some people even have like alarm clocks that start to light in the morning to help, in theory, naturally wake them up. Melatonin can be made synthetically. It's available as an unregulated supplement. And the unregulated part is huge because anything that's not regulated means that it has a lot of variability in the amount of medication that's in each dosing, whether it's a pill or liquid. Sometimes other substances get put into things that aren't on the label. So I've used it with my own kids, but I do know that there are risks whenever you take unregulated supplements. And that's just part of even the vitamins and supplements that we take for other things. But melatonin can be helpful in getting people to fall asleep. It oftentimes actually helps if you take it much earlier. A lot of people take it right at bedtime, and that's not enough time for it to kick in. So taking it at 4 o'clock in the afternoon or maybe 6 p.m., depending on when kids' bedtime is, oftentimes helps better. And smaller doses oftentimes help better than larger doses. A lot of people will go, 3 milligrams, 10 milligrams, whatever, up higher because they feel like it didn't work well enough. And sometimes taking a smaller dose a little bit earlier actually is more beneficial and safer. But side effects can include things like drowsiness, headaches, dizziness, bedwetting. So it's not without side effects, even though it's a natural supplement. So talk to your prescriber if you're giving it, because sometimes there are better options. And then finally, we're going to talk about relaxation exercises. I am a huge fan of meditation, progressive muscle relaxation, so soothing at bedtime, where you tighten your muscles and relax, breathing exercises, all of these things. And just like learning any new skill, all of these mindfulness things take time, take practice. But if you use it on a regular basis, it's so helpful. And studies have actually shown that mindfulness practice, if you do it on a regular basis, changes your brain in positive ways, decreases the amygdala, which causes anxiety, all these things. So I am a huge fan of mindfulness because there aren't really side effects to this. There's side effects to melatonin, which is natural, but this is great. And if you can have kids practice and use it, I always say just use your favorite search engine, find things to do. I actually gave a talk on mindfulness for ADHDKC I think it was last summer, and you can look at Mind Tricks, something like that. If you look in the recordings on the website or our YouTube page, you can find it because I love mindfulness. Talk for a whole hour about it. So again, if your sleep problems or your child's sleep problems continue, talk to your doctor because there are things that are medical issues that might show up as sleep problems. And definitely talk to your doctor if they snore, where they're pausing with their sleep, that kind of like choking. Sleep apnea is a big problem. Grinding of teeth can also be a sign of obstruction of the airway. If kids feel like they have to move their legs, and it's hard because kids with ADHD always move, but at bedtime, if they describe it as like tingling or bugs crawling on their legs or something like that, iron deficiency is more common in kids with ADHD, and iron deficiency is linked to restless leg. So again, bring it up with your doctor. It's easy enough for them to check ferritin, which is a kind of indicator of iron stores. Anxiety. If your kid is anxious, that will impact sleep. And of course, if they don't sleep, they're going to have more problems with anxiety. So anxiety has very good treatments that in part can be managing their ADHD, but also separate treatments for that. So definitely if anxiety is a problem, talk to your physician and or therapist. If people are not able to fall asleep at the appropriate time, or if they're tired during the day, or they fall asleep in class or at the wheel, those are definite medical indications that require some sort of workup. And if they wake but can't move, sleep paralysis is something that isn't common, but any of those things that just aren't typical, definitely talk to your doc. All right. Mood changes. I definitely feel like kids with ADHD have emotional regulation issues, and I wish it was part of the diagnostic criteria, but it's not. And I get a shake from somebody who is, yeah. All right. So medications can lead to mood changes through different mechanisms. And it's important to think about when the moodiness happens, because if it's when the medicine's working, then think about if it is related to other things. Maybe they're tired, sick, hungry. If it's not one of those things, if it's when the medicine's working, is it because you're getting them to focus so well that now this anxiety that's always been underlying is prominent because they can focus on it, right? If the moodiness happens when the medicine's wearing off, medication might be working great, but the brain is calm. They are enjoying this, being able to be in charge of their brain and their body. All of a sudden, they can't control anymore. And that's really frustrating. Generally, that takes about 30 minutes to kind of regroup. And if during that time you can get kids to do their favorite activity and get food, because a lot of times they're hungry, so they're hangry as the medicine wears off. So especially protein foods. Proteins have tyrosine, which is one of the building blocks of neurotransmitters that we need in our brain. So if you can get them to have a high protein snack, that can very much help as that medicine's wearing off. If the irritability and moodiness is all day long and it's not because of being tired or anxious or any of those things, sometimes it's just the medicine itself, and that probably means the medication will need to be changed. If again it's at the end of the day and just getting food and doing a favorite activity isn't enough, sometimes actually taking a booster dose of medication at the end of the day helps it wear off a little bit slower, and that can help those evening irritability times. I am a big fan of guanfacine. Guanfacine is one of those non-stimulant medications that's a blood pressure medicine. It has been shown to help with mood regulation, emotional regulation. So I will oftentimes use it when kids aren't sleeping or if kids are really struggling with emotional regulation. It can be used with stimulants, and that's how I usually use it. I have a very few number of kids who just take the guanfacine by itself, but it commonly is used along with stimulants. And why that over clonidine? Clonidine tends to make kids more sleepy. So if they struggle with the guanfacine, I will then switch them to clonidine. And I do have some kids on clonidine, but I don't know. I think part of it is the timing that I was trained. None of this was really taught to me in training, and clonidine has been around longer. So when the Intuniv was on the market for the first time, and that's the guanfacine name brand, they had marketers come out or farm reps come out and teach us about it. So I was taught how to use the guanfacine or the guanfacine or the Intuniv, and I wasn't taught really how to use the clonidine. I've started to use it over time when the other stuff wasn't as available, but that's just kind of the training that I got. So clonidine is used, but I feel like more pediatricians are in the boat like me. Psychiatrists probably have been using clonidine much more. Bias there, I guess, is why. So if anybody is moody for whatever cause, whether they have ADHD or not, general mood lifts work. Journaling, exercise, getting outside, eating healthy foods, sleeping on a regular basis, setting that schedule, following it, follow passions. I oftentimes encourage families, if they have a kiddo with ADHD, to let them do something they enjoy. Whatever that thing is. If they like art, have them take an art class. If they like theater, music, sport, whatever, get them on a team, get them in a class, because those build their self-confidence. So often they're broken down. They're told it's estimated 20,000 times more negative comments by the time they're 12. So their self-esteem and their their self-image is so down, they need to be boosted. So headaches and tummy aches. These do happen, not as often as some of the other things, but they are real problems. And headaches and stomach aches are most common at the start of a new medication or if the dose changes. Generally, these are brief. So if kids can tolerate it for a few days, usually that side effect goes away. It can also happen though, again, if someone's been off a medication, like they take summer break and then try to restart at the same dose that they stopped, that might be a little bit much and they might have some side effects for a few days. And so I never recommend kids after a long break start day one of school again. I always recommend starting a few days before school starts. So if they don't feel great, they can have that time to adjust again. Taking medication with food oftentimes helps with some of this, and then avoiding prolonged times. So instead of taking the whole summer break off, maybe take the medicine a day or two a week. Kids always have to do chores or something so that that can help them do things. And unless they really need it for weight, it's good to take medication on a regular basis because kids generally feel better about themselves when they can do whatever, not just the academic stuff. But if you tell your kid to go upstairs, brush their teeth, put their PJs on, and start reading their book, and you'll be up in 10 minutes, and you go up there and they're just looking at their toes, they're frustrated because now you're yelling at them. So bedtime's probably about bad timing because their medicine's not working then anyway. But other things throughout the day, they're hearing all this negative stuff, and they can just grow in self-confidence if they can accomplish what they need to do every day, whatever that is. Headaches and stomach aches, though, can also be related to anxiety. So that is probably one of the more common reasons that I see kids, even with ADHD, because ADHD and anxiety are so interwoven. We need to make sure that they're mentally in a good place if they're complaining of things. And a key to that might be Monday morning is the day they always have headaches and stomach aches, because that's the beginning of school again. Or if they have a big test, or if they have whatever it is that's stressful. Sleep deprivation, again, goes along with ADHD and anxiety, and it is a big cause of headaches and stomach aches. I will get headaches by 3 o'clock in the afternoon if I didn't sleep well the night before. I realized that as a resident, and then again when I was new parent. I got headaches a lot then, and I don't get them as long as I get the sleep I need. Migraines, of course, along those same lines. And then whenever we're sick or have allergies, those can affect headache and stomach aches. All right, and then stimulants and some of the non-stimulant medications can affect heart rate and blood pressure. And so this is not a super big thing to be worried about generally. For a long time, it's been recommended if there's a family history that is concerning for irregular heartbeats, not just holes in the heart, VSDs, things like that, but more the rhythm type things, then getting an EKG on kids prior to starting medication and maybe even after they start the medication on the medication. But the large majority of people don't need an EKG before starting these medications. Even guanfacine and clonidine that affect blood pressure, it's not recommended to get EKGs and cardio workups first. Certainly, if they are extremely tired, checking their blood pressure can make a difference. If kids have low blood pressure because of the clonidine or guanfacine, then drinking lots of fluids and eating salty foods. And I've never had a kid complain when I tell them to eat more salty foods. They love their chips and the pretzels, and that then makes them more thirsty, so then they can keep their blood pressure up if the clonidine or guanfacine gets their blood pressure low. And most of those medications aren't really good blood pressure medicines. They only do that for the first couple days. And then once the body acclimates, that's not a problem anymore. That's one of the big reasons those medications can't be started and stopped, like the stimulants. The alpha agonists that change blood pressure, when you're on it, you need to start low and work up to the dose you need. And if you were going to stop it, you need to back down on the dose slowly so your blood pressure doesn't sky high, because that could cause headache if your blood pressure gets too high. All right. How many of you guys have heard that ADHD meds cause tics? Tics are more common in people that have ADHD, but it's not what we used to think. It used to be thought that tics were exacerbated by medications for ADHD, but I guess I should first say tics are sudden movements like eye blinking, shrugging, head tilting, or vocal tics could be throat clearing, sniffing, humming. Sometimes they involve calling out, saying bad words was once thought to be a common vocal tic, but it's really not. Kids can have either motor tics, vocal tics, or both. And if a person is tired, sick, worried, not well rested, all of those things can exacerbate tics. It is possible that starting a new medication could trigger tics, but in general, tics get better with medication if somebody has ADHD. About 20% of kids with ADHD have chronic tics, but half of kids with tics also have ADHD. So if you have tics, I really feel like it's important to get screened for ADHD. And tics are much more noticeable, although sometimes they're misdiagnosed as allergies or something else, but they can naturally come and go. So it's really hard for some families to recognize if the treatment's working or not, because if they're naturally going away right now, then they seem like they're gone, whether or not you treated or didn't treat. But the big thing with this is stimulants were once thought to cause tics. Now it's felt like they help treat the tics because they help keep people in better control of their mind and their body and helps them feel better so they have less anxiety. So in general, medications are good for tics. Specifically, the guanfacine and clonidine can treat tics as well as ADHD. They're used off-label for tics sometimes. Much better than back in the days that I was in training when we used seizure medications for ticks, and there were so many side effects, and hardly anybody used medications in those days. But right now, there is some pretty good management. So if ticks are bothering your child, then talk to your doc. All right, last but not least, there is a risk to everything, but that also includes not medicating. And that's why there's a big push now to identify people with inattentive ADHD, which is where they're just like all in their mind, not paying attention, not able to focus. But they're not showing outward things like getting up, running around, blurting out answers as much. So they're harder to identify, but they still have significant problems if they're not managed well. Because without appropriate intervention, ADHD can affect academics, social skills, emotional development. It can even shorten a lifespan 9 to 15 years, depending on the study that you read there. ADHD can impair executive functioning, which makes it harder to maintain routines such as regular exercise, eat a balanced diet, and even remember to take your other medications. If you have diabetes, you can't remember to take your medication properly. So that can definitely impact your health. Poor coordination, endurance, and motor planning can lead to decreased participation in sports, which can increase the risk of obesity and under exercise, so you're not getting the cardiovascular benefits. Now, there are a lot of athletes that have ADHD as well, but some people struggle a lot. And then difficulties with emotional regulation, stress management can cause increased cortisol in your body, which also ties in with impulsive eating, which can lead to obesity. And that chronic stress can lead to cardiovascular disease, orthopedic problems, diabetes, other chronic conditions. Impulsivity, inattention, risk-taking behaviors can increase the likelihood of accidents, which can include car crashes, falls, and other injuries. And then, of course, in school, untreated ADHD leads to an increased risk of failing grades, repeating grades, dropping out, or just in general, underachievement of what they could have done. They have bright brain, but forget to turn in all their homework, so they don't get into the schools or the programs they want to do. Or life, great, except they keep failing to meet deadlines, so they get fired from their job, all these things. So difficulty maintaining employment, managing finances, even building relationships is hard, much higher risk of divorce. So this leads to more chronic stress and also can impact healthcare, social supports, things like that. So all of these things. Oh, and people with ADHD are more likely to start smoking or vaping at a young age, have difficulty quitting when they smoke or vape, or other drug and alcohol use. Substance use disorders, much more common in people with ADHD. They try to self-regulate their anxiety or depression, or they don't manage their anxiety or depression. Suicide risks are higher. And so substance use disorder goes down when you appropriately manage ADHD because you build better self-esteem, you have better coping skills, you're better able to do all the healthy habits that you can do to keep your mind and body healthy. So while stimulant medications can be used or misused, when they're used appropriately under the guidance of a prescriber, it decreases the risk of misusing substances in general. So yeah, all of these risks are improved with proper medication management. So there is good news. Most medicines used for ADHD have a really short duration. Even if it's a long-acting medication, it's still 8 to 10 hours. So even if it's a horrible reaction, it can be tolerated for 8 to 10 hours and then stopped. And so many of the side effects decrease over time. So if you're able to tolerate it, you can have some of the benefits of the medication for a time, or have the benefits if you switch around and try to make whatever you're using, whether you're changing the dose or changing the type of medication. Because there are so many medications, and I just had that flow chart of the different types, but within each of those, there are multiple medications. So there's so many options. You just need to work with your prescriber to find the right one. Most of the side effects decrease over time, and if one isn't tolerated, switching to another one's usually going to work. And then don't forget that treatment of ADHD is important, but that isn't only medication. You can use mental health therapists, occupational therapists, coaches, all kinds of different people can help support a child. And parents. Parents need a lot too. And actually, the primary treatment for children with ADHD in the preschool years and in the young school-age kids, along with medications, but some sort of parent behavioral training where parents learn how to help support their kids and set expectations and reinforce the positives and all of these things. So always recommend that. All right, that was a lot. And I'm only 3 minutes late. But if anybody has questions, you can either unmute or put it in the chat box. And then I always try to promote the next things that are coming up. So Community Connect is an every other week online adults chat. The adults group is next meeting in August. The teen group has an August meeting. The parent group does not have an August meeting, but there will be an educator special event. So any of you who are teachers or school professionals in any sort of way can join the August group there. And then the other upcoming events are all here too. So I am going to stop my share so I can go back to that slide and copy paste. You guys have any questions though, please ask.
I wanted to make sure there were a couple of earlier questions in the chat. I think we might have gotten them covered, so please put something in the chat again if for some reason something didn't get answered that you're curious about. That was so helpful. I mean, I was taking notes, there's just always something new that we can learn, and interesting to know about the genetic tests. I think there's a lot of misinformation out there. That was really helpful.
Yeah, I think it's a money-making scheme. If I recommend it, I make money, and that's not the reason to do things. Are places in town that are making a lot of money doing these. So not recommended.
Not needed. The graph, the slides with the graph. Did we have one for the bar graph? Like
The extended release, it basically
it looked
the
differently.
time is just whatever time the duration of action should be, basically. So it would be the same type of graph, whether it's short acting or long acting. It would just be narrower if it's a short acting medicine, longer if it's a long acting medicine. Does that make sense? So bedtime craziness is nuts. Like literally, I started giving my daughter melatonin when she was 2. She didn't sleep through the night till she was 2. She was awful. And I look back and she has ADHD and anxiety. So I'm sure she was up for more of these things from infancy.
One of my daughters has been on it since 2. Same story. Yep.
All right. Any other questions? I know I kept you guys long.
So helpful. Yeah. Thanks.
Good. I'm glad it was.
Thanks everyone for coming. All of our events are always listed on our website, so feel free to go there and check. There's always something going on, or you can even look back at past presentations, I believe. Some of them, maybe.
Yes. Check out the mindfulness one. That's like one of my favorite talks to give. Yeah. And I love mindfulness. I have my app. So that's, I guess, the downside. Like I do use my app at night, but the screen is black when I use the sleepy ones.
Right. So it's just talking to you, maybe leading you through stuff.
Yeah. So either sleep stories or something, mindfulness, progressive muscle relaxation, something.
Yeah. Sleep stories are great for bedtime. One of my daughters has used them on and off for years.
Yeah. It's very detailed oriented with all of the different senses without a purpose. Like there's no like, what's going to happen next?
Right. To get the dopamine going. You don't want it to be too interesting or exciting.
Exactly.
Yeah.
All right. Well, thank you guys.
Thanks everyone. We will be back in September with our next presentation.
All right. Thank you.
Thanks. Bye.